For the millions of Americans who do not get a good night's sleep because of snoring and sleep apnea, a simple procedure performed in the doctor's office is now offering a cure. Snoring. There may be nothing more irritating in a relationship than a partner who snores. More than an irritation, however, snoring is receiving increasing attention as a health warning, a symptom of sleep disturbances which may affect a snorer's health, intellectual and physical performance, and general well-being.
Snoring is an indication that there's some obstruction of airflow. So normally, when we're awake, we're breathing, we're not making noise. If we're snoring, that means something is obstructed. It is almost always a sign of a problem. It might be a mild problem, might be a moderate, or might be severe, but snoring is never normal.
I've been snoring for about 4 or 5 years now. Before I started snoring, I was very active. Sports, extracurricular activities at school, pretty consistent lifestyle. Go to sleep at the same time, wake up every day, same time. And ever since then, it's been pretty inconsistent, which I believe has caused snoring. And I came to Dr. Friedman to see what he can do for me.
Snoring is a vibration caused by a restricted, narrowed airway during sleep. Snoring occurs because air travels faster through a narrow tube than a broad one. This causes the relaxed, soft tissue of the throat to vibrate, which results in the sound we know as snoring.
There are 5 common areas that often are obstructed and cause snoring. The first area is the nose. It might be the front of the nose, the back of the nose, but that can cause snoring. Could be the palate. The palate is the back part of our throat. And we're all familiar with the uvula, which is that little area, some people call it the punching bag, that sits in the back of our throat. That could collapse and cause snoring. Could be our tongue. Sometimes the tongue falls back and it causes snoring and sleep apnea. And sometimes it's our tonsils that might be enlarged. And finally, there's an area below the tongue called the epiglottis that might cause snoring and sleep apnea.
New research suggests that heavy snoring can increase blood pressure during sleep. Snoring may indicate that you have obstructive sleep apnea, or OSA, where the tongue can be drawn against the airway with such force that the throat is closed and breathing stops. OSA is a potentially serious health threat. It is estimated that well over 80% of those suffering from OSA are going undiagnosed.
Obstructive sleep apnea is caused by blockage of airflow at night. The symptoms can vary. In men, typically one of the early symptoms is snoring. In women, they might not snore, but the symptoms that progress from there are really similar, both in men and women. Both of them can be tired. It affects your energy level. It can cause weight gain. It can affect our mood. People that snore and have sleep apnea can often be depressed. It affects our efficiency. We can't function. It affects our memory. It can cause impotence, high blood pressure, and heart disease.
Until recently, the most common treatment for snoring and OSA has been a CPAP machine, which is cumbersome and difficult for many patients to get used to. Now, there is a relatively painless procedure performed in the doctor's office in less than 20 minutes that can help you stop snoring. In addition to being the first real medical breakthrough in the treatment of snoring, this procedure is also effective in the treatment of mild to moderate sleep apnea.
The procedures that I do to correct snoring and sleep apnea is based on the location of the obstruction. If the obstruction is in the palate, I use palatal stiffening procedure. The palatal stiffening is done by injecting 3 small implants into the palate. This actually brings the palate back to its normal status. It's stiffer and therefore doesn't collapse during sleep. With normal palatal function, the snoring and sometimes sleep apnea is corrected.
On this day, Dr. Michael Friedman is performing the minimally invasive pillar procedure under local anesthesia at the offices of his Advanced Center for Specialty Care in downtown Chicago.
Well, the actual procedure takes only seconds. I usually will inject the palate to anesthetize it, and this takes a few seconds, and then I wait 10 minutes to let the local anesthesia take effect. Once the local anesthesia is working, I'll do the injections, and it takes only seconds. Afterwards, there is some pain, and however, most patients can resume a normal diet and resume full activities the same day. It takes about a month to get the effect where the snoring is reduced or eliminated and the patient's sleep pattern is improved.
I had 2 procedures done this year, and both of them were for my breathing. My experiences were very unique, very different. I had never had any kind of surgery or any kind of procedures done. So they were the best thing I could have done for myself, because now I breathe so much better. I have so much energy in the daytime, and believe me, it's the best thing I could have done for myself. I wish I would have done it a lot sooner.
The Advanced Center for Specialty Care focuses on snoring and sleep apnea. There is no single treatment that really will correct everyone's problems. That's why here we're very thorough. The purpose of our examination is to identify which of the 5 locations is causing the problem in any particular patient. Once I've identified the problem, then I can direct treatment to correct each one of those areas. This gives us outstanding success rates in treating over 10,000 patients with snoring and sleep apnea.
The Advanced Center for Specialty Care was developed 10 years ago by Dr. Friedman to provide a resource center for patients with complicated problems of the upper airway, such as snoring, sleep apnea, sinusitis, and tumors of the thyroid, throat, and neck. Dr. Friedman has treated over 10,000 patients with snoring and sleep apnea.
I had the procedure done in March of this year. Dr. Friedman and his staff were absolutely wonderful. The surgical procedure went exceptionally well. My recovery was, I recovered very quickly, and it has changed my life. In fact, I'm doing things that I haven't done in years. I'm motivated, I'm energetic, I can breathe, I can sleep. It's really changed my life.
The Advanced Center for Specialty Care was created to offer the knowledge and experience of multiple specialists to provide opinions for complicated problems for patients throughout the Chicagoland area, patients referred from surrounding states and other parts of the country, and patients referred from outside the United States seeking evaluation and cutting-edge treatment. Dr. Friedman relies on detailed analyses of the problem and can often provide a solution without invasive surgical procedures. To learn more about Advanced Center for Specialty Care, contact them today or visit chicagoent.com.